All right, breaking news. Listen to this, folks. A second healthcare worker in Texas has tested positive for Ebola. This person also in contact with Thomas Eric Duncan, who died from Ebola. We're going to have all the details on this new development just ahead.
Breaking overnight, protesters and police clash in Hong Kong. Officers in riot gear used pepper spray to try to clear a major thoroughfare. We have a live report.
Battling ISIS, bombs going off in Baghdad as the terrorists make advances in a neighboring province. Just how dire is the situation surrounding Iraq's capital?
All right, good morning and welcome to Early Start, a busy morning. I'm Christine Romans.
Yeah, and I'm John Berman. It's Wednesday, October 15th. It is 5 a.m. in the East. In the breaking news, just got it in a couple minutes ago from Texas. The State Department of Health has just announced that a second healthcare worker at Texas Health Presbyterian Hospital has tested positive for Ebola. This was a second health worker who provided care for the first Ebola patient diagnosed in the United States. The healthcare worker reported a fever Tuesday and was immediately isolated, they say, at the hospital. Health officials have interviewed the latest patient, they say, to quickly identify any contacts or potential exposures, and those people will now be monitored. Testing on a separate specimen will be conducted by the Centers for Disease Control as they try to find out more information. Now, while that's going on, there are also stunning accusations this morning against the Dallas hospital that treated the Liberian man who died of Ebola last week. You know what? I want to go straight now to Elizabeth Cohen, who is on the phone for us right now. And Elizabeth, this is the second healthcare worker now diagnosed with Ebola, the second healthcare worker who treated Thomas Eric Duncan. There seems to be serious questions now about the procedures and protocols in place at Texas Health Presbyterian.
That's right, John. This is a black eye not just against Texas Health Presbyterian, but also against the public health system in this country, because these workers were supposed to be protected. Months ago, hospitals were told to make sure that they could take care of Ebola patients. And I think what public health officials are starting to realize is that it may just be unrealistic to think that every hospital in this country knows how to handle this level of an infectious agent. Hospitals, in general have struggled with safety issues. I mean, thousands upon thousands of people die from hospital-acquired infections every year. And so I think that, many experts I've been talking to said the CDC was just was naive in thinking that any hospital could handle these. And I think this will renew calls that we ought to be designating specific hospitals like Emory, like the University of Nebraska, to be handling these patients, not just for the sake of the patients, but for the sake of the workers.
So, Elizabeth, the question is, on Sunday we learned there was one healthcare worker. This morning, now Wednesday, we learned there is two. What are the chances that there could be even more? We know that several other workers came in contact with Thomas Eric Duncan. There seems to be serious question now about the procedures that were in place. So what are the fears that more people could have been infected?
Right. Tom Frieden was very frank about this in press conferences this week. He said, there very well may be more. So I think that there really is a pretty good chance that we're going to be seeing more of these. If the protective gear somehow didn't work or the process didn't work for two of these workers, you have to think that there very well could be more. And, they are right now at the sort of that worrisome window between the time that they would have been infected and the time that symptoms would appear. So we would be seeing this pretty quickly in the coming days.
So how does the CDC say it will prevent this in the future? We heard Thomas Frieden yesterday saying they'll have sort of a CDC SWAT team that will go to places like Texas, Health Presbyterian, should there be cases that develop.
Right, and I think that the thinking there is, if we can just send this SWAT team in, we can get this hospital in order, and we can get them to change their ways and do a better job of protecting their workers. But I think there may be a newer level of thinking, which is, wait a second, if these teams haven't been drilling, if a hospital perhaps doesn't have such a great safety track record, can you really just send a SWAT team in and fix it? And I think that's going to be discussed at the highest levels at the Centers for Disease Control. Is it possible to just sort of parachute in and fix things? Because I'll tell you, safety measures are tough to do, and they're a pain in the neck to do. They're not easy. It's a lot easier not to do them. And hospitals in general have been accused, or many of them have been accused, of just not being tough enough, not being rigorous enough. So I think questions will arise. Can you just parachute in and fix hospitals, or do you want to just designate certain hospitals that have a great track record?
Right, there are those 4 hospitals right now that have these systems and buildings really in place to deal with outbreaks like this.
You know, Elizabeth, what sort of surprises me is the CDC, Tom Frieden, you just pointed out, you know, he said in hindsight he wishes they'd put in a sort of a go team right away to get in there. Are we learning now that we need to have, Washington needs to be there right away and make sure we're using the same protocols across the country?
I think we're learning that, but I also think we're learning that federal officials need to be less trustful of hospitals. Over the summer, I said to federal officials, wait a minute, you're really going to trust that whenever anyone in this country walks in with a fever, that they will be asked a travel history, when nurses are not used to asking that? You really think that you're just going to put out a couple of put information on the CDC website, have some webinars, and you're going to change the practice of thousands of nurses everywhere? And I think they really did think that that would work. I think that the feeling was, well, we're telling them this, so they'll do this. And I think the feeling was that hospitals would sort of snap to it quickly. And I think they were a little bit overconfident about hospitals' ability to do all of these things.
Well, and it does raise the question, Elizabeth, was Texas Health Presbyterian up to this? You know, there was the single Ebola patient, Thomas Eric Duncan. Now there are 2 more. These 2 new patients are in the care of this hospital. You know, are there concerns that this might not be the right place for them?
I think there definitely are concerns. I'm hearing it from officials. I heard it even earlier from safety experts. It's really 2 separate things. One is treating an Ebola patient and saving that individual patient, which can be complicated and which often involves being very aggressive and getting experimental treatments. The second issue is keeping the workers safe. And I think there are concerns that this hospital is having trouble with both of those things.
And now they've got a second nurse who now they have to go back and immediately do that, what's called contact tracing, right, where they have to find every single person that a health aide or health worker was in contact with. And then you've got a bigger pool of potential infected patients.
Well, hopefully that pool will be small, as it was with Nina Pham, and I'll tell you why. They don't have to find every single person who this worker came in contact with over a period of days. They just have to start when they started feeling sick. You are only infectious when you're sick with Ebola. So they just have to ask the worker, when did you start feeling sick? Who did you have contact with from that time until the time you went to the hospital? So for Nina Pham, it was only 1 person.
One thing about nursing in particular, and health aides and the people who are really in direct, constant contact with the patient, Elizabeth, these are people who are really, they're especially if you're treating someone with Ebola, if you're a nurse, I mean, it's kind of nerve-wracking to think of how much contact you're having with protocols that are not really set in stone here.
Well, you know, it's interesting. I think the protocols, they're not set in stone, but the protocols are pretty established.
Right.
It's practicing those protocols and having a team approach. I mean, I think whatever profession you're in, you know that your team performs well when you're a team and when you've drilled and when you've had meetings and you've thought it through. If that hasn't happened, it's hard to perform. And, you know, I think nurses may be especially at risk because they just spend more time with patients than the doctors do. A nurse who has treated Ebola patients said to me, we're talking liters and liters of bodily fluids. I mean, I don't want to get too graphic, but it is copious amounts of fluids coming out of these Ebola patients. And keeping that, you know, off your skin and keeping that out of your, that's not easy.
Elizabeth, we're going to let you go in a second because we have to let you do some reporting on this because this information just coming out minutes ago that a second health worker has tested positive for Ebola in Dallas. You've spent a lot of time there over the last couple weeks, Elizabeth, and I just wonder if you can give us a sense of what the atmosphere in the medical community is like right now. Is it one of confidence? Is it one of anxiety? Is it one of anger?
I was speaking with a physician in Dallas who said this is a scary time to be a healthcare worker, and I think that sentiment is probably shared not just by physicians in Dallas, but in other parts of the country as well. You just don't know who's walking into your office, and fever and abdominal pain and nausea and vomiting are such common symptoms. And so it's hard to know if someone walks in with those symptoms you need to ask them a travel history. How close do you get to them? I think that this is really causing a fair amount of anxiety among healthcare workers in general.
Would you say, Elizabeth, that the American response so far has been clunky to the Ebola threat?
I think part of it has been relatively smooth. For example, the contact tracing in the community, in many respects, has gone smoothly, and we've seen that nobody in the community has gotten sick, and they're getting towards the end of their incubation period. So I think in some ways that has gone well. I think what really hasn't gone well is keeping track of healthcare workers, again, because I think there was this confidence. They're wearing protective gear. They're healthcare workers. The hospital is protecting them. And I think that some of that confidence and some of that trust was, may have been misplaced.
All right, Elizabeth, we're going to check back in with you in a little bit. We're going to let you make some phone calls right now, but I want to remind people what has led up to this. Again, we just got the breaking news that a second health worker has tested positive for Ebola in Texas. Now, before we got this news, even before word that a second healthcare worker was testing positive, a national nurses union was claiming that the guidelines were constantly changing at Texas Health Presbyterian and that there were no protocols for Ebola treatment. The union cited nurses at the hospital who it would not name to protect them from possible retaliation. The hospital released a statement last night saying, quote, "We have numerous measures in place to provide a safe working environment, including mandatory annual training and a 24/7 hotline and other mechanisms that allow for anonymous reporting."
Now, the CDC responded to the nurses' claims with a statement saying it's, quote, committed to their safety. Earlier Tuesday, CDC Director Thomas Frieden, he admitted that federal health officials did not do all they should have to prevent Ebola from spreading from Thomas Eric Duncan to the Texas Health Presbyterian nurse who cared for him. And now this breaking news that there is a second healthcare worker in Dallas who has tested positive for Ebola. Now, Frieden promised Tuesday to put a team of Ebola experts on the ground within hours after a confirmed diagnosis anywhere in the country. All right, 13 minutes past the hour.